In this video, we will address proper body mechanics, positioning, and transfer techniques when using a Hoyer lift. First, raise the bed to caregiver height if possible. This will help maintain proper body mechanics. While keeping your back straight, bend your knees slightly with one foot in front of the other. Grip the draw sheet as close to the client's body as possible. Use both your arms and legs to assist with pulling the client. It is important to be as close to your client as possible when positioning them. It may be necessary to reposition the client's legs, shoulders, and head to ensure that you are as close to the client as possible. When rolling the client to the left, bend the client's right knee. Adjust the client's shoulders if necessary, and cross the client's arm over their stomach. Next, roll the client to the left by pushing on their right hip and right shoulder. When rolling the client to the right, bend the client's left knee, cross the client's arm over their stomach, and roll the client to the right by pushing on their left hip and left shoulder. Now we will address placing the Hoyer lift sling in preparation for the transfer. Again, the caregiver should elevate the bed to about hip height to avoid excessive bending. Fold the sling in half prior to moving the client. Remember to raise the bed rails if you have access to a hospital bed. With your knees bent and one foot slightly in front of the other, use your legs and arms to roll the client onto their side. Now take the folded sling and tuck it underneath the client. The upper edge of the sling should be tucked under the shoulders. The farther you tuck the sling under the client, the easier it will be to unroll it on the other side. Once the sling is tucked underneath the client, roll the client onto their back on top of the folded sling and raise the bed rails. You now need to roll the client to the opposite side to unroll the sling. Roll the client towards the opposite side and untuck the folded portion of the sling. Once the sling is untucked, the client can be rolled onto their back. The client should now be centered on the sling. If you have a split leg sling, readjust the leg straps so that they are placed in between the client's legs. If you are not able to raise the bed, we will now show you how to roll the client safely without this feature. Position yourself so that you are as close to the client as possible. First, place one knee on the bed and squat with the other leg on the floor. Place one hand on the client's shoulder and the other hand near the hip. Use your whole body to roll the client onto their side. This technique can be further modified by having the caregiver kneel in bed on both knees as close to the client as possible. Again, place your hands on the client's hip and shoulder to roll them onto their side. It can often be difficult to reposition the client in bed, especially if they need to be pulled towards the head of the bed. To make this easier, if possible, raise the foot of the bed so that gravity can assist you with this process. If possible, stand behind the bed and grasp each side of the draw sheet near the client's head. Bend both knees and keep one leg slightly in front of the other. The knee that is closest to the bed can be placed against the edge of the bed to assist. Keep your back flat and bend slightly at the waist. Use your whole body to pull the client towards the head of the bed. Before you begin using the Hoyer lift, make sure the wheelchair is set up and ready for transfer. Bring the footrests on the chair up so that they are out of the way. We will begin with the transfer, and the process of attaching the slings to the hooks will be explained at a later point. Once the client is positioned in the sling, use the lift to raise them out of the bed. This video shows a manual Hoyer lift, but it will operate the same as a power lift. As you are lifting the client, make sure their head is supported in the sling. Rotate the client so they are facing you before pulling the Hoyer lift away from the bed. With the client in the Hoyer lift, the caregiver should place one foot at the base of the lift and their knee against the Hoyer lift to propel it forward with their arms. Widen the base of the Hoyer lift so that it can straddle around the power wheelchair. Push the Hoyer lift close to the chair so that the client is directly over the seat. Begin to lower them into the seat. The caregiver can use one of their knees or both hands to place against the client's knees to help position the client towards the back of the wheelchair. It is important to pay attention to the client's facial expressions. It is beneficial for you to establish a preferred way of communicating with your clients, especially during transfers. One example would be having the client raise their eyebrows for yes and holding the eyes closed for no. Carefully and slowly lower the hooks to remove the loops. It is important to protect the client's head at this point in the transfer. Although the transfer is complete, It might not be possible, but it is ideal to remove the sling to protect the client's skin integrity. To do this, begin by uncrossing the legs of the sling and removing them from underneath the client's legs. Next, place one hand behind the head and your other hand between the shoulder blades. Pull the client towards you and remove the sling, keeping your hand behind their back. Position their hands on the armrests and check their clothing and readjust if necessary. After placing the arms on the armrest, lean the client forward while keeping the head and neck aligned to relieve pressure. To relieve pressure from the client's bottom, use the tilt feature to lean the chair backwards. Tuck the chin to keep the spine in a neutral position. To relieve pressure from the back of the head, tilt the head forward by sliding your hand behind the head and pushing it forward. This is also a great way to stretch the neck. Watch the client's facial expressions to see when they've had enough of the stretch. To relieve the pressure from the elbows, move the arm in a position that allows the edge of the elbow to float without touching the armrest. To provide additional pressure relief from the elbows and reduce shoulder or neck pain, remove the armrest and place the hand on a flat surface to provide support. To relieve pressure on the hips, shift the client's weight by grabbing under their hips and pulling their bottom forward or to the side. Lift each leg individually to relieve pressure off the back of the leg. When repositioning the client, caregivers can utilize more force by placing one foot on the wheelchair cushion and placing their hands under the client's calves to pull them forward. Only utilize this technique if you are able to do so safely. To stretch the client's hip rotators, place the client in a full tilt with their legs extended. Then, cross the legs over one another at the ankle and the knee. Before using the Hoyer lift to transfer the client back to bed, make sure the wheelchair is no longer tilted or reclined. To place the Hoyer sling behind the client while they are in the power wheelchair, place one hand behind the head and your other hand between the shoulder blades. Pull the client towards you, keeping the hand behind their back. Use your free hand to place the sling behind the client's back, making sure the center of the sling is directly behind them. Position the straps to the sides so that they are out of the way. It is helpful to find a landmark on the sling so you can quickly tell which part is the top of the sling. This may be a handle, a tag, or something else on the sling that catches your eye. Bring the leg parts of the sling to the outside of the client's legs, then run them underneath the client's legs. Be sure to cross the two leg straps. Lift the foot plates of the power wheelchair before getting the Hoyer lift into place. Widen the base of the Hoyer lift and move it so that it straddles around the power wheelchair. Lower the Hoyer lift hooks and place the straps on the hooks. Remember to place the top straps on a tighter loop than the bottom straps. This keeps the client in a more natural seated position once they are lifted. Remember to cross the leg straps when placing the loops onto the hooks of the Hoyer lift. Slowly lift the client from the chair and pull the Hoyer lift to slowly move it away from the power wheelchair. Place one foot at the base of the Hoyer to help propel the Hoyer lift into the desired position. When approaching the bed, make the base of the Hoyer lift narrow again so it can fit underneath the hospital bed. It may be helpful to place a piece of tape on the bed to mark the spot where you want the client's hips to land to ensure they are in a good position on the bed. Have the client's bottom hover over your landmark. Then rotate their body so their feet are facing the bottom of the bed. It may be helpful to raise the head of the bed before lowering the client. Slowly lower the client onto the bed. Remember that it is helpful to raise the foot of the bed if possible to prevent them from sliding once they are laid down.